So today we'll discuss about mandible. We'll discuss about anatomy of the mandible and the identification of skeletal remains, which is important for your forensic medicine. This is very important for your practical. So in forensic medicine they'll ask you how you identify is it male or female. I'll explain it, and even they'll ask you what is normal position, what is normal anatomy, what is normal processes seen, what are tubercles seen here. So I'll explain the anatomy and even the forensic. Before understanding anatomy, see, this is the anterior region of mandible, this is lateral, and this is posterior region. Let's come to this picture. I'll divide the mandible. Mandible is divided. This structure is called as symphysis, and the structure here is called as body. Till the angle it is called as angle, and till the processes it is called as ramus. This is how the mandible is divided. So the first part, this is known as condylar process, and this is known as coronoid process, the process which is towards the teeth. Okay, this is known as coronoid process, that is known as condylar process, and the arc that comes, that is known as mandibular notch. The notch which comes here is known as mandibular notch. This is called as oblique line of mandible. This is angle of mandible. Here, very important here is, you will see two discs in the bone. One is areola process, one more is mental foramen. This is very important. This looks prominent, mental foramen, and this is called as mental tubercle. Okay, so in the posterior region we have two things. One is mandibular foramen, okay, you can see here, and one more is myohyoid line. The line here, this is known as myohyoid line. So this is basic anatomy they ask in your viva of even anatomy and even forensic medicine. They'll ask how you identify, is it male or female. Very interesting mandible and very easy to remember. So you know that in case of male and female, what you have to know is male, all the male bones are very large, very thick. Females are small and thin. This is basic that you have to explain him. All male bones are large and thick, and females are small and thin. The chin what you have here helps in differentiating. In case of male, the chin is U-shaped. Okay, in case of females it is rounded. Okay, the body height, that is the symphysis height, is very great in male and it's smaller in female. Then we have ascending ramus. See, I said this is ramus, right? Ascending ramus is, this part is called as ascending ramus. The breadth of the ascending ramus is great. It has greater breadth in male as compared to females. Then what is angle? This angle of mandible is less obtuse, that is less than 125 degree, and it looks everted in males, and it is more obtuse, like more than 125 degree, and inverted in females. Then we have this condyles. Can you see this condyle process? Okay, these are large in case of males and smaller in case of females. The mental tubercle is very large and prominent in males and insignificantly seen in females.